Good day everyone. This is part of the quick review series, and the quick review today is about the umbilical artery doppler. In the umbilical cord, we have two umbilical arteries and one umbilical vein. The umbilical arteries, blood is pumped by the fetal heart and it is flowing to the placenta during systole and during diastole, and then it is returned as oxygenated blood in the umbilical vein. With this pattern of pumping, we will have a sawtooth waveform, and this sawtooth, this is the peak systolic velocity. So this is the velocity of blood as it travels to the fetus with maximum contraction of the fetal heart. Travels to the placenta, and then the systole will continue, and then the diastole, and still at the end of diastole, blood is still flowing in the direction of the placenta. So the blood is always in forward direction from the fetus to the placenta in the umbilical artery. Actually, with this forward pressure, with this forward movement, we can conclude and we can diagnose if this placental bed, the placenta, is still a low pressure organ, low vascular pressure organ, or if the placental vascular resistance is increasing, and with the increase in the pressure in the placenta, it starts to obstruct the blood coming from the fetus. We can check this by two things, either by the use of indices, which is resistance index, pulsatility index, ratio between the peak systolic velocity and the end diastolic velocity, or we can check it by just looking at the waveform. In this, for example, we can see in this waveform, this is a normal waveform. I have peak systole and diastole, blood is flowing in the same direction. I cannot find a problem here except if I use indices. So if the flow is forward direction and it is present in the systole and in the end diastole, you cannot diagnose if the placental pressure is rising or not, except if you use the index. The most useful is the resistance index. And the resistance index, or this is peak systolic divided by end diastolic, or the pulsatility index. We don't want to go into mathematics, but the idea is that these indices, they have a value from 2. However, this value is decreasing as we approach term. It decreases as pregnancy advances. So in the third trimester, for example, I would consider this a normal value 0.6. I would consider an 0.7 a high resistance in the third trimester, although it is still within normal. But the thing is that this means that the pressure is in the placenta did not decrease as expected. Same goes for the peak systolic and diastolic ratio, where the figure we have is 3.56 to 2.51. This is second trimester up to third trimester. End of third trimester, 37, 38 weeks, it should go into a very low value. And the pulsatility index the same. So if the waveform is a normal waveform, we look at the indices. Here, for example, the pressure in the placenta starts to rise, and with this rising pressure, it starts to put resistance in front of the blood flowing during diastole. During systole, as the heart contracts, the blood will flow forward direction, no problem. And in the diastole, it will still flow in the forward direction, but with a decrease in the velocity, because there is pressure in front of, pressure facing the flow of blood. And you will find the indices in the third trimester for this patient. The peak systolic divided by the end diastolic is 3.39. This is normal, but this is the high normal. It shouldn't be in the second trimester, it shouldn't be in the end of the third trimester at this value. This is a high value, and the resistance index is 0.7. Yes, it is still within normal. Pulsatility index 1.08, still within normal, but these values, I do not expect to see these values in the third trimester. So this means that placental pressure is a bit high. Here, for example, look at the indices here. These are abnormal. Now in the third trimester, if I have a systolic diastolic ratio of 3.8, if I have 0.74, this is the resistance index, or 1.3 pulsatility index, then the indices are telling me that this placenta is offering too much resistance in front of the blood deoxygenated blood coming from the fetus. If the condition gets a little bit worse, there will be absent end diastolic flow. Blood will flow during systole to the placenta, and then during diastole the resistance will stop the blood from flowing completely. So actually the blood goes to the placenta in systole. In systole there is absent flow. So systole, diastole there is absent flow. Systole, and in diastole there is absent flow. Systole, in diastole there is absent flow. So without indices, if you just look at the waveform, this is quite abnormal, and this means that the placental insufficiency is life-threatening for the fetus. Here is the actual waveform. As you can see, there is absent end diastolic flow. If you look at the indices, you will find that this is the peak systolic divided by the end diastolic velocity. It's 31, which is very high. The pulsatility index is 1.9, which is very high. The resistance index is 0.9, which is abnormal, but this actually it is worse than this. It is worse than 0.968. But anyway, the indices show that there is increased placental resistance. When the condition gets worse, the pressure in the placenta increases more, the blood will flow to the placenta in systole, but in diastole actually the pressure is so strong from the placenta that it will revert the direction of flow, and blood, the deoxygenated blood, will flow back to the fetus. This is called reversed end diastolic flow. We have during systole, blood is moving to the fetus, and then there is a very small gap where there is absent end diastolic flow, and then it reverses. So we have systole and we have reversed diastole. Systole, reversed diastole. Direction of flow, it is not in the same direction. So here are the indices. The peak systolic divided by end diastolic is 52. The resistance index is 0.9. Actually, there is no measure negative. So it's actually the resistance index is much worse. But as you see here, the end diastolic flow cannot be in the negative value. So that's why it's 0.9 only, but it's actually worse than this. The pulsatility index is 3.7. So these are the three things that we see in the waveform. Either it's a normal waveform, or there is absent end diastolic flow, or there is reversed end diastolic flow. And in the normal waveform, you can just look at the indices to check if there is increased resistance index or not. If the condition gets worse, then blood will start to resist the flow of deoxygenated blood from the fetus to the placenta during systole, and this will result in fetal demise. So indices are valuable to assure a normal flow. Waveform is valuable to assure normal flow, and they are more valuable if there is fetal growth restriction, if there is increased placenta resistance, oligohydramnios, if there is infection, some condition which increases the placenta resistance. And in cases of fetal growth restriction, the waveforms are very valuable to determine the severity. And the severity moves from reduced end diastolic flow to absent end diastolic flow to reversed end diastolic flow, and the urgency to terminate pregnancy. Of course, the termination of pregnancy is a decision dependent on the waveforms and the patient. You have to, it's not a paper interpretation, it's a patient treatment. So you have to consider the obstetric history, the gestational age, the waveforms that are present, other factors like so. But generally speaking, if there is reversed end diastolic flow, there is a need for expeditious delivery. Thank you for watching, and see you again soon.